for joining us. Let me just get us started on every single platform. So many of you are on. We are so appreciative. Thank you so much for spending the time with us. And we're going to make good use of this joining us. So let's go ahead and
if you've gone through any WordPress tutorial.
Sorry about that. I'm pressing the wrong buttons. I don't know what is going on here. All right. I think we got it right now. So thank you very much. Tell me that you can hear me. Tell me that you can see me. Tell me all of those things. And let me open up the chat so that you can all see each other. And that would be great. I think should be able to see the chat. So the chat should be good. Should be able to see me. Let me put up my slides and we're going to go ahead and get going. And we thank you so much for spending the time with us. This is great. Tell me who you are, where you're from, what kind of healthcare professional you are, because we have got a lot of people. This is going to sell out or go to capacity in about 2-3 minutes the way it is growing. So thank you so much for being on here with us. We really do appreciate it. Let me just make sure. You should be able to see the chat. Everyone should be able to see the chat as well. So welcome. I mean, you're going to see yourself. It's going to be impossible to welcome all of you. So thank you for me. But you see yourself if you're looking at the chat. Who you are, where you're from, so many people we have got. Physicians, dentists, we have got, I mean, gosh, look at this. Look at this coming through. Thank you for being an AAFE member. Nana, it is great to have you here, and so many others. I mean, you've got every kind of nurse practitioner, PA, RN, estheticians, dentists, physicians. It is so great to have you all on. So thank you so much for being on. I am going to get started. Let me go ahead and fix this a little bit so you can see me a little bit better. And I'm not sure I fixed that much better, but that should be a little bit better. And I'm going to get my slides up and then we are going to get going because we've got a lot to do. So go ahead and feel free to, let me just get the slides to full. You should now see the slides on full, just full everything. I mean, you should be able to see it. Now let me just get that up and let me get this up. And now we are good to go. Tell me that you can just see my slides just to make sure. Then that would be good. Then we know that we've got everything going. Okay, slides full screen. You got me in the corner there or wherever you got me on your screen. We're going to get going. Feel free to answer questions, to ask questions at any time. We're going to go ahead and try to answer them, maybe take a break here or there and answer some questions and go through this. But let me do the quick introductions for going on. I'm so excited that you're here. We've got a lot of video to show you. So anything on your end, if you could go ahead and pause any backup programs if you know how to do any of that. We want you to have the best experience here for all of that. So top 3 secrets using Botox and solid fillers for uplifted, wide open, and beautiful aesthetic eyes. You're going to see some really cool video. My name is Dr. Louis Maltzmacher. I'm president of the American Academy of Facial Aesthetics, otherwise known as the AAFE. There's my email. Feel free to use that before, during, or after this. There's the AAFE's email and a bunch of websites, some of which we're going to talk about if you want to take a quick picture. But we're going to bring up some of these websites so you can go ahead and use them. Go ahead and make sure you follow us on all the different social platforms. We are active on all of them with hundreds of thousands of followers, but millions and millions of views. We post clinical information nearly every single day. For that, at Facial Aesthetics is where you're going to find us. We are a live patient CME certification training. Please take a real curriculum, a real live patient CME certification training. So many of you have gone and taken someone opened a med spa 6 months later, they're giving courses out of their med spa, not CME, no backup, no support. That's what the AAFE is really known for, is a real curriculum, real CME certification, which you need for your medical, dental, nursing, licensing boards. Because if you ever have a patient complaint, you better show that you were trained by a real place rather than Sally in her med spa down the street that just opened a few months ago, or even a year ago or 2 years ago. If it's not CME certification training in medicine, dentistry, or nursing, it's really not really, there's no oversight at all. You don't don't know what you're getting there. But the AAFE always gives a tuition special at aafespecial.com about the AAFE. It's not just me. It is all of these 80 plus wonderful people that are faculty members, and you're seeing a whole collection of physicians, nurses, nurse practitioners, PAs, you've got dental hygienists who can inject in some states. You've got opticians who can inject in some states. You've got really just about everybody. And it is such a multidisciplinary, we learn from everybody, but these are the greatest people in the world. What we really love about all of them is they are wonderful people. They're willing to share. They all have their own practices, and they treat real patients just like you want to. So they are a real wealth of information, and they are by far the best faculty in the world. Again, all CME, that's important. The AAFE is going to offer 20 packages available to you. I'm going to show you those packages in just a minute. Where are our course locations? They're all over the United States and a few international as well. The stars are AAFE training centers, where we have nearly every course every single month. So you can go to any of those destination locations, or we're bi-monthly or quarterly in all of these different locations. But this is what we're really about. I mean, really, we're the most trusted name for injectable training. And we have the post-course support, again, provided by our faculty. We have 8 or 9 full-time faculty members for that. We've trained over 20,000 healthcare professionals. We consult regularly with medical, dental, and nursing boards. I was on with a couple of boards this week already. Collaborate with all the different associations, full-time faculty to help attendees. That's important. I just want to touch on this before we get started, because I think this is really important. Yeah, people tell me, I'm not sure if I want to get trained. People don't have the money. People don't have the money. Are you kidding? For Botox and fillers? Well, they certainly had the money for Cyber Monday. This was just 2 days ago, as of the time of this webinar, right? It was the biggest Cyber Monday after the biggest Black Friday on record. So you had $11.8 billion that people bought things that most of which they don't need. As you know, I probably did the same. You may have done the same as well. That was Black Friday, and then followed up by Cyber Monday or Cyber Week or weekend, another $44.2 billion. That is wild. Don't tell me people don't have the money. I mean, they've got the money. It's just a matter of, are they spending it with you? And again, Botox and fillers keeps growing for that. So this baloney that, the economy, I don't know, the stock market is at its all-time high and keeps getting higher. And you've got this. It's an amazing economy that we're living in right now. So it's hard to say people don't have the money for this. But the problem is, and again, I'm talking to myself as much as I'm talking to you or anybody else, how much money do we buy over, how much money do we spend on stuff that we probably don't really need? Here's the best investment that you can make, and it's life-changing. It's an investment in yourself. When you consider that AAFE injectors that we train are adding anywhere from 10 on the low side to $50,000 to $100,000 a month, whether they are a physician, a dentist, a nurse practitioner, a PA, whatever it is. Again, once you are working in this field, or you want to open up a med spa, or you have an aesthetic practice, or you have a dental practice and you want to add on to that, you should be paying for an investment like this for training $10,000, $20,000, $30,000 a month. This is as important to you as when you spend all that money getting your nursing, dental, or medical license, which costs hundreds of thousands of dollars in some cases. This is really about your financial freedom, your control over your time, over your career, and really building the dream practice and loving what you do and getting paid for it. That's what it's really about. So let me show you the AAFE packages that they're going to offer. There are only 20 of these packages available, and then we're going to get straight to our topic tonight. For that, you're not going to find this anywhere else on the AAFE website. This is only here, aafespecial.com. It's only until midnight tonight. And this is a 3 live patient certification course package for $42.97, the Ultimate Injector package. Plus, you will get all of these bonuses. And this is better than what they were offering probably over the weekend, because it comes with all of these different bonuses right here for that, including business training. The AAFE Med Spa and Aesthetic Practice business training just updated. Up to $1,250 worth of $1,250 worth of injectables to be used at the course. One team member for each course. This is the 3-course package. I'm going to show you another package in a minute. Access to exclusive membership and forums and support. 12 months of AAFE membership. All office forms that you're going to need, etc., etc. You see, this is a total package value over $13,000 that you are going to get for $4,297. This is an investment in you, and it's life-changing. How do we know that? Because we train thousands of injectors every single year, and we've got thousands of them as AAFE members and on our forums, and they can tell you themselves for that. So that's one of the packages. You can go to the QR code, which will take you to aafespecial.com, or this is a 2-course package that you can get for $3,097. The 3-course package is definitely a better deal. It comes with more benefits, obviously, but really it's up to you as to what you want. You can start with a level 1 Botox and fillers, level 2 Botox and fillers. If you already have some experience, if you have more experience, we have a level 3 Botox and fillers, total comprehensive care, all of those different things. We have master courses. We've got all these different courses that you can choose from. Don't worry about location. Just grab a package before midnight tonight. The AAFE will get you into the location and the date that you want, and that's what they have to offer. This is the best deal that you are going to find. Not on the AAFE website. This is the only place you're going to find it, and it's only till midnight tonight. We want to make you the best injector. By the way, we don't want to make you a product injector. We don't want to make you a Botox injector, because there are lots of Botox injectors out there. We want to make you the best injector. By the way, use this now. A year from now, it doesn't matter. Just lock this in and get all these bonuses, which you are not going to find anywhere else. So there are usually a lot of training questions, and we will go ahead and take more questions later on. I just wanted to get this out there because many of you want to grab this. Sarah, you register at aafespecial.com or go to that QR code for that. You can check with their schedule for courses in Hawaii or come to the mainland, and you've got a year from now. You can take them whenever you want. This is, but lock this in. Definitely lock this in if you want. I see there's a lot of interest already, Stephanie. Lock this in. Again, you don't have to take it by next week. You can take it next year, which is not too far away. You can take it at the end of next year. But we really want you to get started now. By the way, we're the only ones that are really going to push you to go ahead and get moving, okay? If I say this honestly, if you don't want to be bothered, the AAFE is not for you. But we're going to drag you by the nose practically to get started, because these are the most valuable skills that you get. Nothing else is going to get you $10, $20, $50, $100,000 a month in production. And we've got med spa, aesthetic practice, business training, all the forms that you want. We're going to make you successful. And that's why people keep coming back to the AAFE. Whether you're just starting, but even if you are an advanced injector already, we have so much that we can really go ahead and help you with there. So thank you, Carol. She says it's so worth it. For a live course, can you inject another clinician also taking the course? Yes, and we encourage you to bring your own patients to the course, because you go home and you get to see what happens. We'll talk more later about that, but I just want to put it out there. aafespecial.com, get your cameras out, go to that QR code, because I'm going to show you a few more QR codes of things coming up. And then open it for later, and then register, because you only got till midnight tonight. One more thing we are giving this coming Tuesday is Fix Bad Botox. I don't know if you know this, but National Botox Day was November 19th, just a few weeks ago. And that is one of the biggest days where people get fourth quarter, and that's one of the biggest days where people go ahead and get Botox. Now it is a few weeks later, and now we're starting to see all the bad Botox complications for people that went to injectors that may not be very precise, because you're going to learn this is all about precision. And they got a droopy eye, they got a droopy lip, they got a droopy this or that because of a sloppy technique, and maybe an injector that wasn't AAFE trained or wasn't trained very well at all. Maybe you watched a few YouTube videos. It's kind of crazy out there. But for that, how do you fix all of that? you should be the expert on how to fix all of this. This coming Tuesday, we're having a live virtual training on fixing bad Botox and fixing those droopy eyelids, eyebrows, broken smiles, and lips. So if you want that, QR code or go to aafewebinars.com and you can go ahead and do that. If you're having a problem with sound, you may want to go out and come back in again. Maybe that'll help, or get a better connection and see what's going to happen there. All right, and one more thing. Okay, and then we're going to get started. In 2 weeks, we are having 2 separate nights. One's for nurses, or I think it's for nurses and physicians, but they just wrote nurses here. But it's for nurses, Botox, fillers, and freedom, how to build your dream nursing career in facial aesthetics. QR code at the top, or aafewebinars.com. This is a free webinar on the business of Botox for nurses and medical professionals. And then the bottom one, the next night, Tuesday, December 16th, we're doing one specifically for dentists, because the dental practice is going to be a little bit different there, and how to add $10,000 to $50,000 monthly to your dental practice without new patients and equipment. And these 2 webinars specific to to medical and dental, we're going to talk about the business of Botox and how to build a really successful practice for that. So again, two QR codes, or go to aafewebinars.com. This is a free webinar. Now we got that out of the way. It's a dream practice with injectables. What do we all love about injectables? And again, if you're an injector already, you can chime in. What do you love about a practice with injectables? Recurring revenue center in your office, because you're going to learn Botox lasts for 3 to 4 months, or any of the neurotoxins last 3 to 4 months. Fillers last 6 to 12 to 18 months, depending on the filler. So patients come back over and over again. It's the happiest part of your practice. It's literally a dream practice. The most popular aesthetic procedures in the world. There's nothing else that comes close. And we always say this, and it's so true. And again, tell me your experience if you're on here and you inject already. It's a dream practice, and you get paid what you are really worth. But you've got to put the work in. You've got to build that practice, and we're here to help you on how to do that. No capital investment, no huge inventory. Ask your family and friends if you should offer Botox and fillers. The whole paradigm of a practice has changed, because Gen Z and millennials now make up 35% of injectable patients, and they're going to be your patients forever. If they're getting started in their 20s, they're going to be doing this till they're 80 plus for that. AAFE members in 2025 are up 30 to 48%. Some of you have taken training elsewhere. Are you up 30 to 48%? We constantly are working with AAFE members to go ahead and improve their practice, and that's what our forums are for. It's filled with advice from real practitioners. If you've been thinking about doing this for a long time, do it. If you're already an injector, you've got to add on to your skills, and that's where our level 2 and level 3 and lots of master courses come on. But let's go ahead and talk about the eyes, and we're going to show you how to kind of reshape the eyes just with neurotoxin, just with Botox and the like. And also, we're also going to show you how to use solid fillers to do the same. And the combination is really what is really fantastic for that. So signs of aging around the eyes are among the earliest that present to the patient. When they starting to age, it's the eyes that start to show it first. And it's those crow's feet around the eyes. It's all these lines in the forehead. It's all of that. But also, opening those eyes is what you can really do once you understand how neurotoxin works. And we're going to go ahead and talk about it. But let's just talk about the eyes right now. Look at all the different things that happen with the eyes as we age, from expression lines to drooping eyebrows and lids and loss of the lid crease, lower lid laxity. All that happens, and it happens in layers. It happens in skin, it happens in dermis, it happens in SMAS and ligaments, and it happens all the way down to the muscle and to the bone. The bone starts to resorb around the eyes as well. Why are eyes so important? Because they are a central feature of beauty. I'm going to show you a couple of things that are really, really amazing here. They did a study a number of years ago. I don't know, I'm not really into art all that much, but this is a famous piece of art. If you know what it is, please feel free to go ahead and jump in for all of that. But what they did was they traced the people that were coming to see this art, their eyes, and they were on this painting. Where were their eyes going? the people watching the art, where were their eyes going? They were going to the eyes of the art and to the mouth, back to the eyes, and to the mouth, and back to the eyes. I think this is just an amazing thing. This is a 1950 Vogue cover by Erwin Blumenfeld, okay? But just look at that face. All you are seeing are one eye, lips, and a little defining birthmark for that. And you can imagine in your mind a full face, and that looks like it's going to be a very aesthetic face, just from the eyes and some lips and a birthmark, just to give it a little bit of an imperfection there. That's how important the eyes are. And it's not just that. Who are the good guys and who are the bad guys, or good ladies and bad ladies when it comes to that, right? The good animations, they've got these really big, beautiful eyes. We just love them. And then the bad guys are, they've got these sinister looking eyes for that. So that's why eyes are so important. If I can open the eyes with injectables, and again, if you're brand new here, you've never touched Botox or fillers or anything else like that, that's okay. We want you to understand these concepts to see the depth of what you can really do once you start getting into this and see what the possibilities are. And again, whole faces are important, but you see how important just the eyes are for all of these things. It's the injector plus the neurotoxin. It's not just the product you're going to use, whether it's Botox, which is the #1 neurotoxin in the world. Xeomin is the #2. We like Xeomin a lot. It's a little less expensive to the practitioner, and you can pass it on to the patient if you wish, but it'll work exactly the same. You've got Daxxify, you've got Jeuveau, you've got Dysport, a little bit of a different animal. All of these are different molecules, but they all will basically work the same. But they're all tools in the toolbox is what they really are. You are the artist, right? You're the person that's got to put this all together, and you've got to learn the 3 core things, which again, we're going to show you some videos so you understand it. It's about anatomy, it's about safety, and technique. When I say anatomy, what I mean is anatomy and evaluation and assessment and treatment planning and diagnosis, and then technique is delivering the treatment, but ultimately it's really about the safety. And neurotoxin, one of the safest pharmaceuticals on planet Earth right now, especially when used for aesthetic purposes. But I'll add one more thing to this, and that goes into the technique. It is all about precision. That's what it's really about. And just a quick review, even if you know this, quick review for how does neurotoxin work, because this is really, really important. I'm going to make one really important point here, which you're going to see when we get to the neurotoxin videos. We're going to keep referencing over and over again. How does the whole thing work? Why does Botox, I'm just going to call every neurotoxin Botox right now. Why does it smooth lines? Because you're not injecting into the skin. You are injecting into the muscle, the motor muscle. And you can see certainly my frontalis, my forehead muscle. And when I pick it up, I don't get Botox. And when I pick it up, it will go ahead and wrinkle the skin underneath there when I go to rest. And I've been wrinkling skin for so long, that skin is still wrinkled, and even at rest. That's what happens over time. If you're a 20-year-old or a 25-year-old, you start to develop these really fine lines, and you don't want them. And you never have to have them. And that's what we kind of call baby Botox and all those things, which again, are much easier to treat, and those lines will go completely away, and they won't develop. These lines, for sure, they won't develop, and they never have to have a line really in their life. How does it work? You're injecting the neurotoxin, the Botox, into the muscle, not into the skin, into the muscle, and the neurotoxin molecule is going to bind to the acetylcholine receptors. If you remember biochemistry, literally 101, literally 101, which it was just because I'm a nerd and I was that's what I wanted to do. I took actually Biochem 101 in high school because they had an advanced placement or something like that. This is literally one of the first things they teach you. How do muscles contract? You've got neurons, a motor neuron, that this is the neuromuscular junction right here. And if you block the receptors that go, acetylcholine makes that motor muscle contract. If you block them with the neurotoxin muscle, then that muscle will go to sleep for about 3 months. It'll kick in about anywhere from 1 to 5 to 10 days. Most of the neurotoxins kick in fairly quickly for that, and they start to lose that muscle function, and skin's natural state is smooth. That's how you get the smoothing effect. It's got nothing to do with the skin. We are attacking the underlying muscle and smoothing out the skin that way for that. Now, it's the first 2 to 4 hours are critical for this uptake of the neurotoxin molecule at the neuromuscular junction. That is really, really important. You don't want to disturb it. You don't want to go do hot yoga or sit in the sun. These are very fragile proteins that you do not want to disturb, and they can break down in the first few hours, and then the patient doesn't get an effect. So that's really, really important for that. All things you learn in training you may know already here. But what I want to go ahead and show you our patient and take you through her evaluation to see how are we going to raise her eyebrows and open up her eyes. And that's going to be crucial to what we're going to do. What are we going to use? We're going to use the most comfortable needle around, and this is called the ComfortTox syringe. You can get it at statds.com. They cover it. It's the only syringe that we use in AAFE training. Why? Because when you're a clinician and you're given a lot of injections as part of Botox and fillers, you want to be known as the most comfortable injector, because people will come just for that, and they want a comfortable experience. And if you can be different than everybody else, then that really sets you apart. That's the ComfortTox syringe on this micrograph on the bottom, right out of the package. It's a multi-bevel, super sharp technology. The not ComfortTox is a very popular insulin syringe that's used. It's ragged, and you feel it in your hands when you're injecting, and the patient certainly feels it as it's ripping through the tissue to deliver the neurotoxin. So that's really where you want to go ahead and be, but it's going to be about assessment. So we're going to show you a fairly simple case, and then we're also going to show you how to raise the eyebrows with a solid filler that you're going to see. That's going to be a collagen biostimulator, and then we're going to show you another way to lift just the entire face, which is also going to affect the eyes here. So, but when you go ahead and understand the musculature, and that's really what it's all about for this, if you remember anything else, and this is general anatomy, it's definitely facial anatomy that you've all had in your first semester of dental school, medical school, nursing school. You have all had this. So this is somewhere in your brain, and it's just a matter of relearning it and understanding it. So now it's going to be worthwhile. Now it's going to be worth it to you to understand this. But if you remember anything about facial muscles, there are elevators and there are depressors, and they're always in balance with each other. Now, if you go ahead and kind of, take out some of these muscles or weaken these muscles with neurotoxin, then if you weaken a depressor, then you can lift things with the elevator. For example, the frontalis is an elevator. This muscle here elevates the eyebrows. What goes ahead and depresses the eyebrows? Muscles called the corrugator, muscles called the orbicularis oculi. They will pull eyebrows down. They will pull the medial eyebrow down. They'll pull the lateral eyebrow down. You can do one or the other, and you can balance all of these things by adjusting how much Botox you're going to give where, and there you can literally reshape the upper face. When you get good and you get more comprehensive, level 2, level 3, you can reshape the bottom face, the lower face with neurotoxin. When you really understand all of this comprehensive treatment, you can reshape the total face just by knowing which elevators to go ahead and address to give the depressors. Take out the depressors, the elevators get stronger, lifts the face, lifts the eyebrows. There are some times when I want the depressors to get stronger, believe it or not. So it just depends on where you are on the face for that. Once you understand with all of these things, that's where you get, that just goes back to what we talked about fixing bad Botox. When you really understand this, it's pretty easy to fix bad Botox when somebody has a bad result, which again is another webinar that'll be for next week. But let me take you to our first patient and take you through her assessment. So here we go. Okay, here we are, and Adrienne is our patient today. And come on in. I just want to show you, before we give her some botulinum toxin, I want to show you. She is a perfect model for this. And she's had this before too. And do you like getting botulinum toxin and fillers? And she loves the whole thing.
It's made a
Smooth
huge
threads,
difference.
yeah. Yeah, for sure. But let's take a look at her because something that's really important, I'm just going to turn your head a little bit so just look right into the camera here. Something that's really important for someone like Adrienne here is you want to go ahead and maintain her eyes, and even so, maybe even lift her eyes up and open her eyes a little bit more. Now, we always talk about in the AAFE about having shallow, medium, or deep eyes, and she has these beautiful deep eyes, and she is blessed with them. And that is the great thing about it, is that it's easier to treat someone with her kind of eyes because you can really maintain it. But even so, she may have a little bit of hooding right here, which is not uncommon, especially for someone with deeper set eyes here. So we'd like to give her some bright open eyes. So the way to do that with toxin here is you've got to really understand the different muscles here. So go ahead and raise your eyebrows for me. Okay, so you can see, raise her eyebrows here. I'm going to turn you here just a little bit so people can see it. Raise your eyebrows. So this frontalis muscle is an elevator, okay? Just relax here again. And so now we're going to treat this. So if we treat this elevator, so if you really over-treat it or you treat it too low, you are going to come down fairly deep. And we don't want to do that. We do not want to depress our eyebrows. Would you be happy like this?
Absolutely
if your
not.
eyebrows felt like this for 3 months?
No,
she would not like that at all. So we want to go ahead and at least maintain it, but maybe even open it up a little bit. So when you treat this frontalis, if this is part of your treatment plan, many patients have the treatment plan, just get rid of all the wrinkles in the forehead and it'll maintain her eyes even so. But if part of the treatment plan is to open her eyes a little bit, we want to make sure the lateral portions, all the way in the lateral here, when we go ahead and treat her of the frontalis, still has some activity to keep that up. Now, the other way, don't forget, elevator muscles are also they work against depressor muscles. And the depressor muscles on her are going to be two muscles. Make a mean face. And here are the corrugators coming in, procerus coming down. This is going to really affect the medial shape of the eyebrow there as well. Just relax again. And you can see that. Make a mean face again. Look how the medials go ahead and really flop down there. So this is all a little bit of a depressor, a little bit against the frontalis. Even though the frontalis is going up, this is a different kind of an action here. And the procerus is going to go ahead and pull down. So that's not going to affect the eyes, the lateral part of the eyes in here, but it's important to go ahead and make sure you treat this. We always treat the glabellar when we treat the frontalis muscle. Otherwise, you really get some muscle recruitment and some bad things can really happen. They get a really weird look. But the other big depressor against the frontalis is going to be, big smile for me, is going to be the orbicularis oculi. And that's why this crunches together. And that orbicularis oculi that comes all the way around. I'm going to turn you this way a little bit. I'm going to move your hair if you don't mind. I'm going to let you do it. There we go. Orbicularis oculi, like this, big smile. And you can see this starts to really constrict. And now go ahead and just kind of squeeze your eyes together, like really squint. Now look what happened to that lateral eyebrow. Just relax again. Now do that again. Take a look at that. That really brings the sound. So this orbicularis oculi, this circular muscle, is a depressor against this frontalis. This wants to raise up. Squeeze your eyes together again. This wants to really pull down. So just relax. So if I can leave a little bit of frontalis here open or just active a little bit, not too active, because if it's really active, it's going to give her this Spock eyebrow. And if she could see this, I'll show it to her on the camera, she would not be happy with that. So I don't want to leave all of this, but if I can leave a little bit of activity here and then take away some of the depressor, again, squeeze your eyes together. That's all orbicularis oculi. If I take away some of this, then it's not being forced down as much, still getting some elevation, and you can open their eyes just with some botulinum toxin. We can also do it with some smooth threads and really add some collagen over time, and that adds some support. We can do it with some filler, very advanced, but certainly there are some challenges when you're using filler in this area there as well. So you can just look back to the camera there as well. So that is what we want to do. We want to maintain this beautiful shape, maybe even give her a little bit of an elevation, keep those eyes open, nice and bright, and she'll get a great response when we go ahead and give her the botulinum toxin. All right, so now let's go ahead and show you the delivery, but I want you to really keep this in mind because the depressors and the elevators, and I want you to see placement. I really want you to see precision, precision, precision. So here we go. Here we go on Adrienne's treatment here, and we are first of all using ComfortDoc syringe, and that is going to be the most comfortable syringe as you can go ahead and see. And Jill Charles MP is treating Adrienne here, and the whole point is to go ahead and make sure that she gets a great, great result, and also that we not only don't drop her eyebrows, but we go ahead and raise them or keep them at least the height that they are, but we're even going to try to raise them a little bit. So on the lateral portions on the frontalis, she is going very light on the toxin and also fairly high up on the toxin. Now, Adrienne has a fairly short forehead in terms of height. So we're going to go ahead and make sure that this is very precision placement so that we can achieve our goals. And again, the frontalis is going to be your elevator muscle. Now we're going to go ahead to the glabellar area, which is going to be more to the medium part of the brow in terms of that. But take care of that procerus, and that is going to release. That's a depressor. Corrugators are also depressors, even though they come sideways, and the frontalis goes ahead and lifts everything up here. So you got to treat this glabellar complex for sure, because if you don't, that will recruit and that will make them look just mean, just because it's going to be always going ahead and contracting there, and their 11s can get a lot worse if you don't. Now, this is really what's crucial, and this is the part of the depressor that we really want to treat. This is going to be the lateral orbicularis oculi, crow's feet, as you go ahead and see. And you can see that these ComfortDoc syringes are doing a great job on her. You're going to get some blebs there, and that's all fine. Always away from the eyebrow. That's going to release that depressor. Now, this is the part, remember when she's squinted, that's the part of the supralateral orbicularis oculi that pulls down. So with the frontalis being very precisely treated and also going ahead and doing precision treatment on the lateral orbicularis oculi, that is how you are going to go ahead and maintain the eye shape or open the eye shape, which is exactly what we want to do for her right there. You'll get some bleeding. That's going to be normal. Bruising can be possible there as well, as much as we try to avoid it there. But it's, every once in a while, you'll get a hematoma there as well. And now we're going to go ahead and do that supralateral orbicularis oculi. Very specific. That's not a magic point. Don't get the idea that that's a magic point for injection there. That does not apply to every patient. Every patient is different. But now we're going to go to masseter treatment here as well.
Go like E.
And let's go ahead and move the camera around. We're all trying to get in here. And this is going to be, what are we treating here?
Yeah.
DAO. Okay, DAO. I can't see because I'm upside down from the patient here. You're doing DAO on the other side too? Okay, here, let's try to catch this DAO. You can see right there. We'll talk about the DAO another time, but now let's go to masseter treatment. Okay, so now let's go to masseter treatment. Masseter treatment we'll leave again for another video here as well. But treat the masseter. It's a magic muscle here. Okay, you get so many benefits when you go ahead and treat the masseter here. We're all trying to get around and get a good view here. So here you go, in and give it and get out, and that is great here. Okay, how did you do, Adrienne?
Really good.
Okay, she did just great. Okay, until next time, we'll see you later. All right, so let's go ahead and show you her before and after. Obviously, she got some lips done, and she bruises so easily, this patient. Every patient's a little bit different on her, but take a look at the before and after, and what you're looking for is, did we raise up this eyebrow? And that is going to be really important. And how do we know that? Look at the amount of space between the eyebrow and the top eyelid here. And it's subtle, but when you go ahead and really map it out, what you see over here on this other side, that's quite a difference, and that's more than just a few millimeters. And you can take a look at how her eyes are definitely going to be wider. So getting a nice eyebrow lift with neurotoxin by understanding depressors and elevators, taking out some of the elevators, but not taking out the ones that really matter, going ahead and taking out the depressors so that the elevators can work a little bit harder. That is the balance that we are really trying to achieve here. So we'll answer some questions on this. And I guess we're going to answer it right now on this, and then we're going to go to fillers. But I just wanted to show you this for this, because I think this is a really, really powerful. Keep asking questions. We'll answer questions in just a minute because I've got on multiple sites here some questions about the neurotoxin part for that. But I want to go back just to, I want to keep knocking away at this so that you really understand, what do people buy? Why are they buying? And again, we just went through the biggest buying spree in history over this weekend between Black Friday and Cyber Mondays. It's a real lesson for all of us. So, when people tell me, no one's buying Botox anymore. No, they're just not buying you. I mean, that's what they're not buying. But let me ask you folks, what would you pay for this backpack? And we'll show you this from all over. And put it in the chat. I want to know in the chat, would you pay $1,000 for this backpack? Tell me right now, would you pay $1,000 for this backpack? Right? Yes or no? Right? Probably $14.99. Okay, that's good. No, here's the difference between unsuccessful people when it comes to evaluating what kind of investment are they going to make, whether it's in themselves or in buying something, and really successful people here. Well, you would pay $25, you wouldn't pay $1,000. Nobody would pay any of that. What if here's really the key here. Really not really unsuccessful, but people who are less successful, I won't even call them unsuccessful. People who are less successful are going to say, how much does it cost? Like, well, what's the cost for that? Jessica, I don't know if everyone saw what Jessica wrote, because it could be I'm the only one that saw it. Jessica asked the right question. Do you know what really successful people will say? What's in the backpack? Like, what's the value? Really successful people. I'm not talking rich people. I'm just talking about successful people. Don't worry about the cost. The cost is not the point. What's in the backpack? What am I buying? What's the value that I'm buying? How is it going to go ahead and service me? I'm so proud of you, Jessica, because what if I told you that backpack has $100,000 in it? Now, would you pay $1,000 for it? Well, those of you who wouldn't just lost, $100,000. Those of you who paid $1,000 just got $99,000. It's not, the cost is not the point. The value and what it brings to you is the point. And that, I think, is why so many of you are going after these. After this is now the perfect analogy to your investment in yourself. So I'll answer a couple of training questions, but I'll answer more Botox questions now, and then I'll leave more training questions for later. Okay, $42.97 is your investment. Whether you're starting off at level 1 and just getting started, whether it's level 2, level 3, more advanced procedures that's going to grow your practice, all of those things. That is such a minor investment for what you're getting, not just from the whole value of what you're getting in this package with all these bonuses, the business, the team members, the injectables you're getting to use at courses, the membership, the support. It's about the value. The cost almost doesn't matter, because as I'm going to show you later, in your first 5 to 6 patients that you're going to treat with Botox and fillers and whatnot, is going to blow away that $42.97. It's value. It's not about the cost for all of that. And we all just blew so much money on cost over this past weekend for stuff that's not going to give us much value, right? Just because we wanted it, just because it felt good, or we thought it was going to be on sale and never going to be on sale again. So first of all, I got to give these packages are going fast. Again, there are 20 packages available. Shout out to Irene, to Jennifer, to Bailey, to Christopher, to Christina, to Rachel, to Tamara, to Jeanette. It's probably about 10 of these that are already gone. So congratulations to all of you. Again, Don't worry about location. The AAFE will get you a location that you want, and they'll get you the date that you want. The AAFE will get hold of you tomorrow to get you started in whatever courses that you are going to sign up for. So congratulations to you. Again, there are two packages. This is a 3 live patient certification package, and this is a 2 live patient certification package. They both come with bonuses, so really you will make out just fine. Go to aafespecial.com or that QR code. So let me go ahead and answer a few questions, and then we're going to go to solid fillers. 2 kinds of solid fillers, smooth and lifting, and you're going to see what it does to the eyes and to the upper face there as well. Let me just answer some quick questions here. Good. Carol wanted to know if the backpack was full of Xeomin and PDO threads. That would be worth easily over, I don't know, about $100,000, but it'd be worth probably $10,000 worth. I could probably get more of it in there. How many units did we put into the frontalis, glabella, and well, I'm not sure what CF is for that, but crow's feet, I guess, for that. Well, we put in her probably, again, I'm just going from kind of memory, probably about 12 units in the frontalis. We probably did about 20 units or so in the glabellar area for all of that, because we really wanted to take out all those depressors. And then in the brow, those brow injections, we probably only put in about 2 or 3 units. You don't need much in those brow injections to really get it, but it's about the balance. Now, by the way, I just threw out some units. If those of you who have never been trained before, don't worry about what units are. That's just how the Botox and neurotoxins come. But it doesn't help you at all, to be honest, because without the evaluation of every single patient, without knowing their muscle mass, muscle intensity, exactly how their elevators and depressors work, that's why we have them go through those phases so we can really market. What I just gave her has got nothing to do with your patient. And some of you have been trained with a real cookbook approach, by the way, and that cookbook approach is garbage. I mean, that's why we are fixing so much bad Botox now. It's because so many people got trained with always give 20 units into the forehead. I said something on the video, that neurotoxin video. I said something that some of you probably have missed because I say it pretty fast for that. There is one huge determining factor for how much neurotoxin we put in the forehead, and that is, do they have shallow, medium, or deep set eyes? And that is something you're only going to learn in the AAFE. No one else teaches it. And it is the biggest determining factor for how you treat the frontalis. And that's all I'm going to say for now, because that's an hour lecture by itself for right now. But, you can treat the glabellar without the frontalis. What would happen? You would only get rid of frown lines. It wouldn't affect the eyebrow position hardly at all. How many spots to treat the forehead? How big is our forehead? That's the only determining factor. It's got nothing. There is no such thing as a set pattern for any forehead or a set pattern for any glabellar or anywhere you're giving neurotoxin for that. It is careful assessment. You got to know the anatomy. It's all about precision for all of that. Anybody that tells you differently is going to be a really poor injector, and we're going to be fixing that Botox in the next couple of weeks. I can guarantee you. And those of you who be AAFE trained know exactly what I'm talking about, because that's really how you have been trained for that. All right, let's go to fillers, because we're going to go to fillers. We're going to go to fillers here too. Oh yeah, the fixing bad Botox again this coming Tuesday. If you want it also to midnight tonight, only $79. Then it goes up. If you want to pay the full fee, I'm sure the AAFE won't mind. QR code, or go to aafewebinars.com and you can register there as well for that. This is going to be a live virtual training, and it also has a 14-day replay, this one. So don't worry, if you can replay it and really learn the lessons on this. I should have said that before. For that. So this is going to be a really good session coming up. All right, how else can we raise the eyebrows? Well, another way to raise the eyebrows is going to be by going ahead and putting some filler in there and right above the eyebrows to give it the support and raise them up. But we're not going to use dermal filler or hyaluronic acid filler because there are a lot of different vessels in this area that we do not want to put pressure on or occlude. We are going to use smooth, solid filler PDO threads for that. The best ones on the market are by a company called Vsoft Lift. What makes them the best? They grow the most collagen, because that's what we're going to do. We're going to grow collagen for that. Take a look at this bottom micrograph right here, and you will see this is from a study on collagen production in smooth PDO threads. Here, this is a cross section. Here's the smooth PDO thread. All of this, as this breaks down, a PDO thread is a polydioxanone suture material. It's been around for 50, 60 years, and it absorbs very slowly over the course of 4 to 8 weeks. But when you use it for aesthetic purposes, as it starts to dissolve, the body's reaction to it is by growing its own natural collagen. And that is what's going to fill this up, and that's what's going to support the eyebrow in the case we're going to use it for. We use it all over the face to give us collagen biostimulation. So it's an amazing thing, and you're going to see it. You're going to see exactly what I'm talking about for this. So here's that blown up a little bit. Production of collagen, neocollagenesis. This is a slow process, so it'll happen over the course of a month to 2 months to 3 months, but it will last a lot longer than any filler. That's exactly what it will do, and it'll also give you lots of collagen regeneration, revascularization, and smooth skin. There's so many benefits to going ahead and using it here. By far, Vsoft Lift makes the best one. Very few that even sell smooth PDO threads anymore for that, but why is Vsoft Lift so good? I'm also going to show you their lifting PDO threads, because that's going to lift the entire face, and you'll see how that supports the upper face and especially the eyes there as well. But now let's just stick with smooth PDO threads. For every one Vsoft Lift smooth PDO thread, you need 3 to 4 Nova threads. Why in the world would you want to use more? You don't want to use more. You want to use the least amount of threads for the maximum result. Let me show you this great case. So here we go. And these are so easy to use. All right, here we go. We have got a double header treatment here for you, so to speak. We are using solid filler smooth PDO threads to go ahead and raise the eyebrows by building natural collagen. As these PDO threads start to break down, then the body's reaction is to build natural collagen. That's going to give some lift to the eyebrows slowly and subtly over time. This will take a month or two to see the final results here, but look how few threads we are using. The Vsoft Lift brand of smooth PDO threads, FDA cleared class 2, plus the fact they build the most collagen because they break down slowly because of a special polymer coating that nobody else has. Go ahead and place them in place. Turn them 360, pull them out. That engages the thread in the tissue here. And so that's all we're going to need. Now, you see other threads that will need 2 to 3 times the number of threads. This is a tight, small area. It's going to be hard to get anything more than that. And why would you use any other kind of thread if this produces the most collagen and is FDA cleared class 2? Now, we're going to go right into that area for the temple deficiency, the peanut head area. We've treated her before, and now we're just placing the last few in here that she is going to need to really fill things out. This gives you also an immediate visible result with some structure underneath the skin, but this gets better and better over time. Now, you need to be certification trained by the AAFE to determine the right plane. You've got to go into the subdermal plane, and that is why these are going in so easily. Now, would I use hyaluronic acid dermal fillers here? No way. I mean, you can, certainly, and there are ways to do it safely, but it certainly is an area where you can get some significant vascular events happening. Everybody knows that in both areas, above the eyebrow, certainly in the temple area. So if you've got something better, especially with a younger patient with tight skin like this, solid filler smooth PDO threads is a better injectable to use than hyaluronic acid dermal fillers, which is great for many areas, but use the best tool that's appropriate for what you are doing here. And now we're going to go ahead and do this on the other side. And let's concentrate a little more on the technique on this side here. Patient has had some Comfortox BLT for about 10 minutes, and that really helps with topical anesthetic. And now we are going into the right plane. Look how shallow of an angle we're coming in. This requires training, live patient hands-on training and virtual training, certification training to really get the hang of this. Because once you get the hang of this, especially if you have some experience with injectables, it's very easy to go ahead and place this here. Now, that is a lesson for you right there. If you got some bleeding here, and that is probably the superficial temporal artery, had this been dermal fillers, then guess what? You may have had the possibility of a vascular event, an occlusion, or a compression, which can be just as bad as an occlusion there. That's the advantage of solid filler smooth PDO threads. Here we went ahead and we nicked it or went through it, and that's okay. It'll stop just like any bleeding stops. But I know that I will never occlude any kind of a vessel, and that's what makes it so safe, especially for the temple area. This is the first go-to. We will go back and use some filler sometimes. You've got to be very well trained. That's very advanced to use hyaluronic acid fillers here. But if you've got this and the patient is willing to go ahead and wait for their more natural results over a 2 to 3 month period, sometimes even after 1 month, you'll see significant collagen production with V-Soft Lift, then that's the way to go. Now here we put in a little different pattern than the other side, again, going in that subdermal plane. If it's too superficial, it'll be very hard to put in. And if it's too deep, then you're not going to feel any resistance at all. So you've got to know the right resistance. And here we get some bleeding again. That's okay here. And now let's see some of the great results that we are going to achieve. Subtle enhancement of that eyebrow lift and shape. As you can see, this patient wanted more of an arch. She did not want the foxtail lift, but she wanted more of an arch and more support and more eyebrow space. That's exactly what you're seeing on both sides. Also, take a look at her temple areas. Look how it built out her temple areas and really filled in that peanut head, as we call it, all in a very quick. Her total treatment time was what? 3.5, not even 4 minutes. You can get these results too. This is about 2 months later after a couple of treatments. It's time for you to add solid filler smooth PDO threads into your office, and certainly time for you to learn the best techniques by going and getting some AAFE certification. So make sure you get AAFE certification trained today. Okay, so let's go ahead. And again, you can really go ahead and see. So we did 2 things on her. I mean, we really did a number of things on her for sure. By the way, none of these patients are only getting this or that, what you're seeing in the video. They're getting full face, just about everything. Neurotoxin filler, smooth PDO threads, lifting PDO threads. You'll see a little bit of all that coming up. But just look at her eyebrow space and how much it's increased here. And that's from putting the solid filler there. Once it kicks in and you grow some collagen, then that's going to really lift things up. It really did her peanut head. We'll talk about temples another time. For this, really, it's really incredible for that. Getting to the right plane is fairly easy, but it takes some practice here. And once you get that feeling and you know you're in the right plane, again, if you're too deep, it's going to just kind of fall in. If you're too superficial, you're in the epidermis, and it is going to be very tough going. So that is what you learn in training, and you can learn this virtually, by the way. I'll show you how you can learn it virtually. And once you practice a little bit, once you get the right plane, you can put these in all day, every day. It is literally one of the favorite things that AAFE nurses and I like to treat with patients in our AAFE training centers and in our AAFE med spas because it is so easy. There's none of the vascular compromise or vascular occlusion, things that you have to deal with. It grows collagen. It lasts longer. It's fairly easy to do with topical anesthetic. It's very quick. I mean, we really love doing these cases. They're a lot of fun to go ahead and do for that, but they do a great job. It lifts the brows with temple volume, opens up the eyes. That's exactly what we're looking for this. And we do full face. This is that same patient before. This cheek that we did on her was with smooth PDO threads. There was no filler, dermal filler, hyaluronic acid filler in here. It is smooth PDO threads. And on her, we used 20 V-Soft Lift smooth PDO threads, 10 on each side. And this is the result that we got. takes 1 to 3 treatments. On her, we did 3 treatments. So this is after the 3rd treatment, about a month later, and you can see how much has really kicked in. You can also see, again, with the neurotoxin that we did, we opened up her eyebrow space and lifted her eyebrows here as well. I mean, again, we're never doing just a little bit of neurotoxin or a little bit of fillers. It's really more about comprehensive treatment, which you get to when you learn level 1, level 2, level 3, a real curriculum for all of that. But take a look. Each treatment, which is, if she needs 3 appointments, that's 650, 750, 850 times 3 for that, and about 4 to 6 weeks apart. This lasts 12 to 24 months. This is really great. It usually lasts a lot longer than that for that. Where can you learn to do smooth PDO threads? Well, if you bought one of those packages, you could certainly use one of the package courses for this. Or if you just want to learn smooth PDO threads, the AAFE has the only virtual CME certification training. This is completely virtual. Go to aafevirtual.com. It's $500 off for the next 24 hours, and you will be able to go ahead and learn this. And there's a module in here that will, and they send you a box of PDO threads, of Vsoft Lift PDO threads as well for the hands-on training, because there's a module that will take you step by step on either a chicken breast, which you can buy at any store, a skin pad on Amazon, which is like $10. They'll tell you exactly what to get, and you can practice a little bit. Once you get the feel of that right plane, it is so easy going in. This patient was done literally an hour after this doctor finished the course. He started putting these things in on patients. I think this was his sister-in-law or something like that. Sister-in-laws are really good to practice on for that. It's $500 off for the next 24 hours. Again, this is completely virtual. It's 8 hours. You're going to learn smooth PDO threads all over the face, neck, décolleté, and they'll talk about certain parts of the body there as well. If you're an AAFE member, you save $200 more. So $797 for AAFE members, $997 for non-members. That is a great value. If you're ready to do Botox and fillers, to us, there are 4 injectables. There is neurotoxin, there is fillers, there is smooth PDO threads for collagen biostimulation, and then there is lifting PDO threads, which we are going to talk about right now. And then there are the combination cases that we'll do. And again, keep asking questions. We'll take questions as we get nearer to the end for this. This is a local influencer, local to Cleveland, Ohio, even though obviously she's got a national audience. But and the great thing about influencers is they take their own pictures, they do their own editing, they post their own results. It's the greatest thing in the world. Combination with her of neurotoxin and lifting smooth PDO threads, which you just saw. So the 2 things we showed you already are the 2 things that we did a combination treatment on her, and you can see, because she had very, very flat eyebrows, a lot of wrinkles, obviously, and she was really happy. Look how her eyes are more open. Look at her better eyebrow shape, and that is from smooth PDO threads up in here, neurotoxin here, and just about everywhere else she was getting. Well, she had a very subtle lip enhancement, wasn't into the lip thing just yet. Since then, she's had all kinds of treatment done for that. So that's a nice thing, and they even make their own side-by-sides. Love treating influencers, obviously not just for the benefit of they tag you and all those things, but just love treating influencers because they make their own before and afters. That's really the greatest thing in the world. Now, let's go to lifting PDO threads, and we're going to show you how when you lift the whole face, what happens to the eyes there as well. And this patient's a good example of this. This, again, to us, there's neurotoxin, for, again, all the smoothing and for muscle control, facial pain, oral facial pain, migraines, headaches. That we'll leave that topic for another day. There's fillers for volume, the hyaluronic acid, juvederms, and Restylane for volume. There's smooth PO threads for a collagen biostimulator. These are the 4 essential ones. These are the 4 legs of the table. Then you add on PRF and all kinds of other stuff. So we'll talk about it if there are questions about it. But lifting PO threads, fantastic, because you're going to literally lift the whole face. And when you lift the whole face, that also lifts up the cheeks, that lifts up the sides of the eyes, and just, you'll see, it just lifts everything up. Here, this patient came in, not for Botox, not for fillers, but she hated all the jowling. We lift everything up, and it's a different face, and you can all learn to do this too. This is a little bit more advanced, but those of you that are more advanced, you're probably ready for some lifting PDO threads. But what's the trick to lifting PDO threads? You've got to use the strongest thread on the market, the minimal amount of threads for the maximum result. Not what you see. I'll show you some examples, but not what you see on on social media where they're putting in 20 threads on each side of the face to try to get a lift. That means they're using a very, very weak thread. So this is why we use the VSoft lift exclusively in AAFE training, is exactly for this reason. It is because it's the strongest thread. We have to use the least amount of threads, and you're going to see exactly what I mean. So this is what I was talking about with this. This is a Mint PDO case, or it might be a Nova Threads case. They pretty much treat them exactly the same. They've had trainers that go back and forth between the two companies. And you're talking about 20 threads. You count them. You're talking about 20 threads on each side of the face. And they'll tell you that you have to sedate these patients afterwards. You have to give them narcotics for pain control and also antibiotics just to cover them in case anything goes wrong. That's not the way we do it. I mean, literally, it's not the way we do it for that. You'll see what an AAFE case with VSoft threads. And I appreciate Carol, what she said. It is a game changer. If you're already doing Botox and fillers, you need to add smooth PDO threads. You need to have lifting PDO threads. Again, grab one of those packages because there's lifting PDO threads 1 and level 2, and we've got all kinds of different courses no matter what you want for this. This is not an AAFE case or a VSoft lift case. This is the one on the left, an AAFE or a VSoft lift case. We're only going to use 4 threads on each side of the face, depending on the patient, and get a result that is better, if not, I mean, certainly better with a lot less thing. Carol, took 10 years off of your face. I'm sure you were beautiful before, Carol. Now you're even just a younger beautiful for that. I'm glad you had a great experience, but it is amazing. I mean, literally listen to Carol. All right, let me show you a video on this again, just a taste of it. So here we go. Go ahead and get into place and already direct me in the right plane. And I keep talking about being in the right plane, and that is so important. You want to be in that SMAS layer to really grab that SMAS layer and pull everything up as you're going to go ahead and see. But we're delivering lidocaine 2% slowly, just a little bit as we go ahead and retract in the retrograde fashion here. We don't want to use a lot of liquid here. We don't want to use a lot of lidocaine. The reason being is because we don't want to flood the area. We've got to make sure that our lifting threads are going to be able to go ahead and really engage the area. So now it's a matter of staying in that right plane. And again, this you're all going to learn in training here, but we're going to go ahead and put that in. You'll be able to see it in just a second. Place that into the tunnel. And as you see, we're not forcing anything. Even if we come upon a ligament, must know the anatomy, we are going to go ahead and very controlled with the non-dominant hand, go ahead and do this. Now here, as you get around that curve to the nasolabial fold, you've got to use a pinch technique and a curtain over the curtain rod technique at the same time. So you're going to pinch the tissue up and then move it on to the PDO thread. And then when we get it to place, it doesn't have to go the whole length of this cannula by any means. It's going to go to where our end marking is. Once we know where that is, this is a very controlled procedure, then we're going to go ahead and really push on the tissue, really exaggerate that lift as you're going to see, and pull that all the way out. Always must know where the tip of your instrument is every single second. You can never lose sight of that, and that is what will give you the great results here. But look at this. Now we're going to really exaggerate this. We're going to pull that straight out, and we're going to exaggerate the lift, pull out that cannula that exposes the thread. And on this case, as you can see, we are actually using a molded PDO thread, and it is from the RD edition of the VSoft lift. Why a molded thread? This patient has got some heavier tissue, as you'll see in the before and after, and you need some extra strength. The VSoft Lift barbed threads are typically 20-25% stronger than any other barbed thread on the market, but their molded threads are 25% stronger than that. So for this case, when you see the before and after, you'll understand she's got heavier tissue. We need a molded thread and the most strength available. Number 2 thread is going in. We're doing the exact same procedure, going along the tunnel that we've pre-tunneled here, and make sure it's very controlled. I don't know about you, but when I see other people do these, whether they're trainers or whether they are providers of PDO threadlifts, and they are stabbing through the tissue, and you can literally see how uncomfortable the patient is, but more importantly, how traumatic the procedure here. Not here. This is AAFE techniques. Make sure it's very controlled. This way you never lose sight of the tip. You always know that you're in the right plane. Exaggerate the lift, pull it out, and you can see it exposes that thread. And we've got 2 of them in just a few minutes. This does not take very long when you are properly certification trained by the AAFE. But the AAFE techniques are not only mapping out the vectors, it's also the placement, it's also using the best thread available, all those things part and parcel. You total the whole thing up. That's the reason in this case you only need a few threads, and even if you're doing the 3-vector lift, jawline and neck, as we will finally we will accomplish here, even if you're doing that, this patient's getting a total of, I don't know, maybe 5, 6, 7 threads total, where you see other threads and other techniques will use 20 threads, 15 threads on this side. Well, I don't think you want that or your patient wants that. And that's really what makes the combination of the AAFE techniques that you'll learn in certification training and VSoft Lift threads, the most powerful threads on the market. That's what you want when you get them all. Now we're going for the 3rd thread. Can use the same pilot hole. You don't have to. You can definitely use another pilot hole if you're in a different vector, but here it's just as easy to use the same pilot hole and go ahead and massage that tissue, pick it up, pinch it, pull it over the thread, over the cannula that the thread comes in, always knowing exactly where the end of your cannula is. You can see it's all the way down right where we want. Exaggerate the lift, pull it out, and you can see a beautiful 3-vector lift, and you can see how it's really pulled everything up very, very nicely. Look what we've accomplished with just 3 threads here. Look at this amazing transformation before and after. Now, this was with a total of 7 threads on each side of the face. That is just amazing. She hasn't had botulinum toxin or fillers. Now we would go back and give her botulinum toxin and fillers. But what an incredible, incredible transformation of before and after. Remember, just 7 threads, not 15 or 20 like you see with other PDO threads, which are not as strong, or other techniques which are not AAFE techniques. AAFE techniques are the best. Use the best PDO thread. It is time for you to add this to your practice. Time for you to get AAFE certification trained today. Okay, and that is, look at this case. It's an amazing, amazing case for that. And you saw, I mean, you saw it with your own eyes, how many threads it took. It didn't take 10, it didn't take 20, it didn't take 6 or whatever number. That's an amazing thing. But look what it did also to her eyes. It opened them up. When you put support, first of all, she has cheeks all of a sudden, right? That did not come from any hyaluronic acid filler. All of a sudden, she's got cheeks. 3 on each side. Your cost $210. Patient fee easily $12.50 on the really low end. I mean, I don't think anybody would charge $12.50. They're going to charge more again for the result, not for the amount of threads you're using. So this easily is more towards the $18.50, even over $2,000. Some of the AAFE members charge. When you get good at it, this is a 20-minute appointment. Number of treatments 1, results lasting 12 to 24 months. Certainly, you can put in an extra thread if you need it. Just depends on it. But this is something to add if you're already an injector, if you're just getting started, start with your Botox and fillers. You'll add on smooth PDO threads, add on lifting PDO threads as you go through all of this. It's a major impact in your practice. Carol loves it. This patient loves it. A lot of AAFE members really love it for their practices. And again, I have to tell you, a lot of them got it for themselves. Two ways to get trained in lifting PDO threads. First of all, you can go ahead and use any of the courses from your package. Those of you who got, I'll give you a shout out for the names that have popped up since, because those 20 packages are going fast. I will tell you that. So you can go to aafetraining.com, or here, again, if you just want to get training in lifting PDO threads, go to vsoftlift.us, and they have got PDO thread packages, meaning if you buy this amount of threads, then they'll send you to an AAFE training. You can get to an AAFE group training on lifting PDO threads. If you buy a bigger package, they will actually send an AAFE trainer to your office, full AAFE training, but it's going to happen privately in your office. Treat 3 or 4 of your patients right in your own office. Get your entire office set up. They do those private trainings all the time. So that's going to be through vSoftLift. Either way, it's going to be AAFE CME certification training for lifting PDO threads. So you got a lot of options when it comes to training. So I'm going to answer questions in just a minute. Let me just go through this. But again, it's not just about the neurotoxin, not just about treating the forehead or raising the eyebrows, opening up the eyes like you see in this patient. It's about the cheeks, the lips, the chin, the jaws, the entire package for that. But I will tell you this, when it comes to neurotoxin, what we learned at the beginning of this was elevators, depressors, knowing how it all works together. You're not going to learn that all at once. You're going to, in level 1, you're going to learn how to give 80% of the bread and butter Botox and filler procedures. That's going to start to build your practice. And then again, if you're already an injector, an advanced injector, we've got so many advanced level courses that really you've got to expand your menu. I mean, all of these patients have had total facial aesthetics, as we call it. Faces lifted, eyes wide open, much better performance. I mean, this patient just has kind of like, she struggles on the left side of your screen to even show her teeth for that, because everything has fallen. She's had lifting PDO threads first to go ahead and pick everything up. Smooth PDO threads for collagen biostimulation, obviously neurotoxin to reshape her face, and fillers to volumize and do all of those different things. Again, we'll answer questions in just a minute. And this patient, one of our favorites, because she's an AAFE member, she's a nurse practitioner, Erin, and she went through our entire curriculum. And then she at some point she looked in the mirror and said, I need a lift. I need this. I need that. And with treatment sequencing, again, which you learn over the time and over the curriculum, this is what you can really go ahead and do. So you can take, as Carol said, you can take off years off of your life here. All right, let me go ahead and answer a question, but let me just make some announcements and shout outs real quick. AAFE has great cadaver lab coming up. Next one is Scottsdale in January. If you want, you can use your course package that you got towards this course. It's actually 2 courses. It's a cadaver lab and ultrasound training for advanced injectors. Right now, it's $1,000 off if you just want to buy that. So you go to aafeanatomy.com. Follow us on all the social media outlets. Here again, there's a lot of you that want this. So again, this is this Tuesday. It comes with a 14-day replay. Fix bad Botox, be the go-to complications expert, because we're seeing a lot of bad Botox we always see in the fourth quarter now. Now is really when it kicks in. And now is when it becomes an emergency to these patients, because they got to get fixed before the holidays, before the holiday party, right? Before New Year's and Christmas and everything else coming up. And now it's starting to kick in badly. And if you're going to learn it the right way, learn it the AAFE way to do it. But you also got to learn, and this is great, you literally can build a practice just on being the complications on fixing bad Botox. And if you understand the anatomy, which is what we're going to go through in this session this coming Tuesday, then you will. It's not that hard to fix bad Botox, and we'll show you all the tips and tricks to do that. QR code, or go to aafewebinars.com for that before it goes up by midnight tonight. And then in 2 weeks, we are having for nurses and medical professionals, Botox, fillers, and freedom, how to build your dream nursing career in facial aesthetics. That's the top QR code for direct registration. And for dentists, Tuesday, December 16th, because the dental practice is going to be significantly different. how to go ahead and get Botox and fillers into your dental practice. This is open if you've never touched Botox before, or if you're already trained and really want to develop that aesthetic practice, again, as a medical professional or as a dental professional for that. The nurses will talk about all the different options open to nurses and what you can possibly do with this and how to build a successful practice. Best faculty in the world. They're all real injectors themselves and all have great practices. So they're speaking from experience and they love to teach. 20 packages available. We may be down to 5 or 6 at this point in time. These are all our course locations. You'll get, the AAFE will reach out to all of you that already grabbed a package, and we'll get you your locations tomorrow. And again, congratulations to Stephanie and Haley and Colin and Chelsea and Destiny. I don't even know how many have gone through yet so far for that, but I know that these packages are going to be gone before midnight. So if you want it, now's the time to get it. These and more are the courses that you can go ahead and choose from. We've got all kinds of different levels. Level 1 is where you're going to start if you're just getting started. Level 1 Botox, level 1 fillers. If you're a dentist and those of you who want to treat oral facial pain, level 1 TMJ oral facial pain, or level 1 lifting PDO threads. We've got lots to choose from. Master eyes, nose, and lips. I mean, you go to the AAFE website. AAFE will help you choose. You register tonight. Grab a package, lock it in, use it now, use it next year, use it whenever you want, and the AAFE will get you started right away with all of this here. But the AAFE really wanted to do something different for all of you. By the way, these are what we call ready to inject courses. You will be ready to inject when you take an AAFE course. If you're just getting started, certainly if you're more advanced, we are going to push you to get started. If you're just getting started, you can be up and running injecting paying patients in as little as 14 days. And you're gonna learn again from the best faculty that's out there who are real life injectors. We do want you, and this will answer some of the questions that are here, we do want you to bring a patient that's ideal for the learning experience, because you're going to take that patient home. Botox, neurotoxins take 1 to 5 days to kick in. How are you going to know unless you bring a patient and take them home with you? So it can be a team member, it can be a spouse, it can be a friend, a good friend. You're going to be very popular. You're going to have a lot of friends all of a sudden who are going to want to be patients for this and wanting to be patients of your office. But it's really one-on-one instruction and accredited courses. But these are ready to inject. Again, we are going to push you to go ahead and do this. And it's time, whatever money you spend over the weekend, forget about it. That's not going to nearly give you the value of investing in yourself. And that's why the AAFE is the #1 training that injectors use to make $10 to $50 to $100,000 a month. And your family, by the way, and existing patients are already paying someone else for Botox. They might as well pay you. We love this before and after. Look at this. Very square face before. You put in you take neurotoxin, reshape the face, more of a heart-shaped face, build out the volume areas like the cheeks, like the lips, like anything that they want. I mean, we put fillers in all kinds of places. We'll use that, leave that for another one of these webinars. It's literally the best investment you can make in yourself that's going to pay you back in your first 5 to 6 patients that will pay for your tuition. There's nothing you have done in your healthcare career, whether it's medical, dental, or nursing, where you've made a small investment of $42.97 or $30.97, 2 or 3 course package, whatever you want, that's going to pay you back this fast. It's literally the training that pays you back, and we're going to get you up and running 14 days, 30 days. It's really up to you, but we're going to push you to be successful for all of that. So really, this is really about your freedom, your autonomy and control. It's going to be the most fun you're ever going to do in dentistry or medicine or nursing for that. But for you, you can really go ahead and build your dream practice and loving your really loving what you do, which is really what it's really all about for that. But you're not going to pay $10,000 or $20,000 for that. You're going to pay $42.97 for a 3-course package. Use it again on whatever courses you want. If you're just starting, it's the level 1. If you're more advanced, level 2 or level 3, or a combination of that. Plus, you're going to get all of these benefits only here. You will not find this on the AAFE website. The only place you'll find it is aafespecial.com or that QR code for that. So you'll get the AAFE Med Spa Aesthetic Practice Business on Demand training with whether you're a medical, dental, nursing. If you want to start to build your own practice, it's going to take you through that. If you want to be an employee, what are the different options? And again, we're going to cover some of that in an upcoming webinar. You're going to get with the 3-course package up to $1,250 of injectables to be used at the courses, 1 team member per course, and you can see worth $1,250, access to exclusive member forums and course support worth nearly $1,000. 12 months of AAFE membership, AAFE member office locator, because we have thousands of consumers that come to the AAFE website every single week looking for AAFE providers. All the office forms you want, additional discounts, all of that. That's the 3-course package, which, by the way, is by far the best value. 2-course package is a great value too, and you are going to get the same bonuses as well. So QR code or aafespecial.com. Let me go ahead and take some questions now. I got a few places to look at questions, so we are going to, I promise you I would go ahead and talk about questions, so let's go ahead and do that for that. Epi, preferably for that. What we do when we do PDO threads is we pre-tunnel the area. Why? It makes it so much easier to go ahead and place the threads in there. I mean, there's no question it's so much easier. We prefer no epi. If you use epi, it's not the end of the world, but we are not looking for vasoconstriction here, and we only need it open for, we don't want them numb with the epinephrine. They're going to be numb for a lot longer. We don't necessarily want that. We don't want them to be numb for very long, and they're going to be pretty comfortable for that. It can be 1% or 2% lidocaine with no epi, preferably. If you only have epi, epi's not the end. It's not the end of the world by any means. They'll just be numb for a little bit longer for that. Really, how do you determine? That's a great question, Teresa. If treatment lasts 12 or 24 months, it's going to depend on the patient and their lifestyle. How much do they? How fast do they age? Really is really what it's going to go ahead and depend on. If they age a little faster, if they're out in the sun a lot, if they smoke and certainly that's not going to be good for them. All the things that really accelerate aging are for that. If they sleep well, if they eat well, if they work out, then they're going to have a different experience for all of that. You can use those, Paul Washa, you can use those threads and laugh lines, marionette lines, smooth PO threads we use everywhere. We use them in the oral commissures to go ahead and lift everything else. Anywhere you use dermal filler, you can use smooth PO threads, just a different mechanism of action. It's collagen biostimulation for that, which is going to be a slow growth of collagen, but it's going to last a lot longer here. So virtual thread lift, QR code, it's aafevirtual.com. I'll show you the final slide in a minute, and I'll show you what you're looking for all of that. Well, hang on. The virtual thread lift, that's what you mean. aafevirtual.com, but I'll show you that on the final slide for that. Let me see what other questions you guys have. Great question, Tanisha. Is PRF or PDO threads a better option to simulate collagen production? PDO threads is definitely a better option. You'll get more collagen production a lot faster. PRF is a lot slower, and we love PRP and PRF. I really should do a webinar on PRP and PRF, maybe coming up next month or in a couple of months for that. We do love PRF. There are advantages to it, by the way. We use both on many patients. We use PRF and PDO threads, especially for hair regrowth. That's a great combination for that. It just depends. You're doing different things. How wide of an area do you want to cover? It's a very wide area. PRF may be a little bit quicker. The downside of PRF, not a downside. It's just what it is. You've got to collect blood. PDO threads is right out of the package, goes right into the patient. But they are different. That's good. PRF is going to have a lot of different growth factors for that. PDO threads is going to give you collagen biostimulation and also neocollagenesis, revascularization. They work in conjunction with each other. We do a lot of PRF on patients too. We do a lot of hyperdilute radius and Sculptra and all kinds of different things for all of that. All right, let's take a look. Okay, I don't know. I don't know what this is here. Okay, somebody's AI full summary. Takeaways from the meeting. Register for the 3-course AAFE package deal. I like this AI. It's really good. Attend the Fixing Bad Botox. Attend the Botox and Fillers for nurses and medical professionals. The business webinar. Yeah, that's good. That's good takeaways for that. I'm liking that AI for that. That's really great. And this just proves to you how smart AI really is. Because it's kind of funny. I'm actually going to take a picture of that because that is really interesting. AI understands that the best investment is going to be yourself. That is really the best investment for all of this. Here, I'm just going to take a picture of that and open that up for that. I'll look at that later for that. I mean, really, that's what it is. It's about the value you get. It's not about the cost. And I guarantee you that many of you, if not all of you, spent more than $4,200 over this past weekend. Okay, it's on gifts. It's on things that you wanted. It's that big screen TV that was on sale finally. What's that going to do to your career? Nothing. It's going to just have you waste more time. You're all entitled to entertainment. I'm not denying anybody any of that. I spent, I buy ridiculous things. You can just ask my wife. I buy ridiculous things all the time. But when are you could finally start investing in yourself? Whether you're brand new and just getting started in Botox and fillers, or you're already doing Botox and fillers and you kind of think you know it all, you don't know it all. It's such a dynamic field. There's so many new things. And it's about technique, technique, technique. That's where the AAFE really comes in to get the best comprehensive results. You're probably ready for a level 2 if you've done your fundamental Botox and fillers, or a level 3 if you're more advanced, or a master lips course, or a nose or eyes course, or cadaver lab. There's so much to learn in the AAFE, plus all the forums and all the support that we have. Invest in yourself instead of all the nonsense that we all invested in this past weekend for this. Can you use Botox eyebrow technique to help with every brow's at 2-week follow-up appointment for that? Absolutely, you can for that. But again, did you cause the heavy brows with Botox? If you did, then you may not want more Botox at that, but you can modify it by certainly doing Botox. That's exactly what we're going to cover this coming Tuesday in the Fix Bad Botox webinar that's coming up. I'll post all the websites again in just a minute. Let me just see if there's anything else here. But I guess that is the main takeaway. AI says so it must be true. So thank you for using that AI full summary, or that AI agent that kind of summarized the whole thing here. All right, let's go. Congratulations to all of you that grab packages. Let me just see if the AAFE sent me any other names for right now, but there are only a few packages left. So if you want a package, now is the time to grab it. 3-course package or 2-course package. Grab it now, $4,297 or $3,097. Only going to see it here. It's only till midnight tonight. So at least open this up, avspecial.com, and you can see for yourself. Here is everything together. This will answer those of you who were asked about this. I'll tell you what everything is. There's my email. There's the AAFE's email. avspecial.com to grab the last 2 or 3 course special packages. AAFEvirtual.com. That's what you wanted with the virtual smooth PDO threads course. If you just want that, go to AAFEvirtual.com. $500 off for the next 24 hours. So if you want to grab it, it will take you through. It's an 8-hour CE course. There's a module for a lesson, and they'll tell you exactly what to get. And they will send you a box of threads that's worth about $350. That is a great value. Learn smooth PDO threads if you're already doing Botox and fillers at the very least for that. StatTDS.com. Comfortox cannulas, Comfortox syringes, Xeomin. They sell injectables, so go check them out. Vsoft Threads or vsoftlift.us. That's the Vsoft Lift brand of PDO threads. And again, we've had thank you to the AAFE members that have talked about how much you love the training and how much you love the results of that. We have a PRF course. It's a virtual course, perfectprf.com, waveaesthetics.com for the best ultrasound, and as always, afewebinars.com. Thank you so much for being on. We hope to see you in the next couple of weeks on our business webinars for nurses, for medical professionals, and for dentists, and or fix bad Botox, and who knows what else will be coming up. Always check out afewebinars.com for upcoming webinars. So take care, everybody. Continued success to all of you. We will talk to you all again real soon. Have a